All right, so I'd like to kick us off for our MDLive webinar. My name is Kylie Rodriguez. I am the benefits manager here at the Consortium, which is your health insurance. And we team up with Excellus, who's our third-party administrator, to manage our claims, both medical and prescription, and they also help us with our wellness program. And they have some great other services as well that I'm sure Jason can tell you about. So we actually are running a MDLive registration campaign right now. So let me see if I can share past you, Jason, so I can share my flyer 1 second. Um, So all you have to do is register for MDLive. MDLive is free. It's a free account that you establish, and then you have access to a doctor 24/7, 365 days a year. There's a variety of ways to register. You can go through your Excellus login, your member login, and access MDLive. That way you can download the MDLive on your phone, and then you would just enter your Excellus ID number to link it up to your account. You can also text or you can call the MDLive phone number. Their customer service is really excellent. They can walk you through the whole registration process in several minutes. So part of that campaign is anyone who's already registered is automatically entered into it. Anyone who registers from yesterday until July 10th also gets to be in the drawing. And then we get a list from Excellus and we randomly draw winners. So one winner will win an Apple Watch. Um, Four more winners will win passes to Strong, the National Museum of Play, which if you haven't been, I promise there's something fun to do for every age. And then also just gonna let some of these other people in real quick. And then 20 winners will win a water bottle. So really, your odds are pretty good about winning something. So I just wanted to make you aware of that campaign. So Jason can walk us through the steps for registering for MDLive and all the services that it can provide. But I just wanted to make you aware of that as well. So Jason is with us from Excellus. He's really our go-to person for support for our wellness program and is very knowledgeable of the MDLive program as well as all other programs with Excellus. So I'm going to turn it over to Jason to present the information today.
I think I'm in.
Jason, you're muted.
Yeah, I am muted. Hi, everybody. Sorry about that. All right, so jumping right in. Thank you, Kylie, so much for inviting myself and Excellus Blue Cross Blue Shield to provide you with this valuable workshop. Obviously, we try to engage with the membership within the Greater Tompkins Consortium as many times as we can, and just to continue to reiterate, some of the great tools, resources that we have. One of my favorite things to talk about, the topic for today, is telemedicine. Before I start with telemedicine, I just wanted to perhaps share with you, again, maybe you've seen this graphic in some of our other presentations, but as a member of Excellus, having Excellus, there's a lot of different tools and resources that you have access to. You could see some of them listed here, right? So you are the member, right? You have Excellus, you have our programs, tools, anytime access. So we want you to have an Excellus account. Hopefully have a primary care provider. Hopefully, if you don't, you have the capability to find one. And again, we'll talk about adding your provider team would include MDLive. So anytime access to telemedicine is certainly the topic for today. Our estimator of costs, a cost translator, if you will, is available. We talk about care management, WellFrame, that's another one, health and wellness. But again, telemedicine is our topic for today. Hopefully you're familiar with some of the services and what I'm going to talk about specifically today. So just wanted to highlight that, getting started anytime access to your health plan. So telehealth versus telemedicine, telehealth and telemedicine, perhaps they are used interchangeably. They give you the option of having a virtual visit with a doctor. Here you can see you have the capability to have a telemedicine visit with either your provider or with MDLive via telephone, email, video chat. Maybe some of you have experienced a telehealth visit with your own provider. but we're going to kind of point out the differences there from those two. So telehealth is actually with your doctor, right? So it's your current primary care provider, maybe it's a specialist. They have telehealth visits. They may offer those in, again, those different modalities, either virtual, maybe it's including text, maybe it is, a video or audio and video, or maybe it's just a phone call. So those are the different features. So just keep that in mind. If you don't know if your doctor or your provider offers telehealth services, all you have to do is call and ask. Perhaps there are, follow-up visits that you have, and maybe they are going to be arranged via telehealth. Can save you a trip, can save you time, and do it really at the convenience of when you are available. In terms of telemedicine, so telehealth, telemedicine is what we actually specifically describe with MDLive. So it's a telemedicine provider. They're one of the largest in the country. Again, if your provider, your doctor is not currently available to have a consult, you can't get in, there's a wait time, as is likely the case. MDLive will give you that 24/7 access to a board certified physician in the United States for any sort of acute illness. So again, non-emergency, right? So if you break your arm, you don't want to have a telemedicine visit. You certainly don't want to have a telehealth visit. There's an applicable way that you should be, going to the appropriate, and that's the purpose of these workshops, is to help you navigate where and when to use which type of provider. So again, we're kind of showing you the difference between telehealth. MDLive does provide acute care treatment, but they also can help with access to a behavioral health provider. So if you are experiencing some sort of stress in your life, right, we're halfway through the week, maybe the week has really gotten to you, you need to talk to somebody. MDLive also offers that behavioral health visit. So again, telehealth versus telemedicine. Telehealth is with your doctor. Telemedicine is with MDLive. Telemedicine services with MDLive. So here, again, you will have 24/7, 365-day on-demand access to that board-certified physician and licensed to practice medicine in any of the 50 states, as well as a behavioral health specialist. So thinking of therapy, maybe it's with a family counselor, a psychiatrist, depending upon, the need for you and for your family. But you do have access to both of these telemedicine services there. MDLive, so you can, here we're showing what they can actually do is diagnose your signs, your overall symptoms, what's going on in your life that day. They can prescribe medication when appropriate. They will not prescribe controlled substances. They can actually help identify a pharmacy. Maybe you have a favorite pharmacy that you go to. The one is right down the road. It's like less than 2 miles from my house. I have it added to my MDLive account. You can do the same. But they can also help identify where pharmacy is going to be available if you're traveling, if you're somewhere in a different location outside of your home and you don't feel well, and they can prescribe a medication there. So they can identify those as well. On the next slide, so when should you be using MDLive telemedicine? So as I've stated already, I think a couple times, your primary care physician you can't get in. They're not around. It is, maybe it's 6 o'clock, right? Your pediatrician's office is closed for your child. If it's after hours, if it's a Saturday, right? So you're not feeling well. Most offices, other than urgent care or emergency room, are open. This is an acute illness, right? So you can have that convenient telemedicine visit on the weekends, or if it's on a holiday, right? So if something has come up, it's, approaching Thanksgiving at some point, you're not feeling well, you can have that holiday telemedicine visit as well. So just a couple of other bullets here. You cannot leave work, right? So you have a packed day, right? You're from 8 to 5 o'clock. You have back-to-back meetings throughout the course of a day. If there's a way to squeeze in 15 minutes, you can have that virtual visit from work, or the convenience of your own home, right? So you don't have to go anywhere to have that MDLive telemedicine visit. If you're on vacation, right? So if you're traveling, maybe you have some summer plans, you're going to someplace maybe a little bit warmer, less rain. You certainly hear vacation, if you're traveling, you can have that MDLive visit with the convenience of having your MDLive account registered. And again, as Kylie mentioned, we will walk you through those steps. So if you do have dependents, I know many campuses are pretty much out for the summer, but if you do have children that live away from home, they're still on your health plan, they're a dependent. Again, if they go back in the fall, it's a convenient way. They can also have that access. So anybody that's currently on the plan can access MDLive. They have to register. So if you have dependents or spouse that are over the age of 18, they will need to create their own account, and we'll show you that coming up shortly. If you do have dependents under the age of 18, so 17 years or younger, you would simply add them to your MDLive account. Again, you can see the critical point here is it is not for any sort of potentially life-threatening condition. So, if you're maybe experiencing stroke symptoms, I know that was our well-being tip that we promoted here at the end of May. If those life-threatening conditions are being experienced, those are things that you would not want to access MDLive. Those are emergency room, those are urgent care. Again, if you break an arm, break a leg, something like that, again, non-life-threatening conditions in this case. So when we talk about acute care illnesses, right? So these are the common illnesses that we might experience throughout the course of our day, specific times of the year, flu season. I know we're in the thick of allergy season right now. There's a lot of allergies going around. Again, it's a non-emergency medical condition, and it can be treated via a telemedicine visit. So MDLive offers you to really have that virtual visit with a board certified physician as well as pediatricians, and they are available 24/7. You can see the list of conditions, not limited to just this, but these are the more common ones that we see. Many of our members, many from the Greater Tompkins Consortium, access, have treatment for, have those virtual visits. Again, just a quick caveat. MDLive does not provide support for UTI infections in males or females. So if you're under the age of 18, it does not provide support for earache conditions, right? So those are typically things that, we should go to the doctor for. So as you build your knowledge of when to and where to go for care, just keep that in mind. Obviously, this is not meant to take place with, having a relationship with your primary care or an office-like setting. But certainly you can have these virtual visits. So if you're experiencing any one of them, at some point, we encourage you to register for MDLive. The other side of the house, so thinking of, when we think of many chronic conditions that we experience in our life that we perhaps can be diagnosed with and have treatment and manage those conditions, behavioral health is one of the leading chronic conditions that we see at Greater Tompkins Consortium and many of the other employer groups that I work with and consult with. But certainly having access is key here. Understanding that you can at any point access the behavioral health team. You can see they do provide highly trained psychiatrists, therapists, family counselors, social workers, and really getting that therapy session started. You can see the conditions here, stress management, maybe something is getting to you during the day. I know in my life, we've got a lot going on at home, but certainly something that you can access and get care for. Talk to somebody, right? The capability to talk to it and talk to a provider. So again, this is virtual. It's super convenient because you can do at any point, in terms of having that therapist behind the scenes, being able to connect with them when you need somebody to talk to, is a great resource. And unfortunately, for those children under the age of 10, they do not provide that specific support for. So perhaps you are looking, you can use our Find a Doctor tool, or our customer care team can help you. But thinking of having access to behavioral health, wanted to highlight that. Again, in any sort of ideation of, homicidal, suicidal thoughts, those types of things, or crisis mode, if, you're experiencing something like that, the 988 number is certainly a way to reach out, or call 911 if those are being experienced. Obviously, experiencing any sort of domestic violence, patients in need of of a controlled substance for a specific diagnosis, again, are not going to be prescribed via MDLive telemedicine. But having those therapy, you do have access to it. And I'll highlight 2 points here. So for having an acute illness right now, MDLive's, I could actually set up and have a visit within 10 minutes, right? It's really convenient. I can finish up the workshop today. And for whatever reason, the lunch I ate is giving me an upset stomach. I could have that virtual visit by the time this is over, ready to go, or I can schedule it for after work. I can pick the time that's going to be convenient for me. In terms of behavioral health, right now it's anywhere from 1 to 3 days. Typically, if you have more elevated symptoms, conditions for behavioral health, and you are in need of a psychiatrist, there might be that 3-day window to get in, but certainly a lot less time at any point to have a behavioral health visit. So acute care you have access to, and behavioral health, right? Convenient capability to do it via your smartphone, your tablet, or on your laptop. I just can't stress it enough. It helps to expand when you have access and are in need of care for an acute illness or a behavioral health condition you are currently experiencing. On the next slide, so here I want to cover behavioral health. So I may have touched on some of these, but behavioral health is something there that can help remove those common barriers of seeking out somebody to talk to in a very convenient, confidential therapy session. So five quick points here. Again, wait times are 3 to 4 times shorter than those traditional in-person. Maybe you can't get in, maybe it's months to actually get an appointment started. Certainly therapists are available on your schedule. They're available nights and weekends. And with any sort of therapist, we strongly encourage the relationship, developing that, having those recurring appointments so that you can continue to work on those stressors that are impacting your life. Also, just to highlight here, MDLive is and offers a HIPAA compliant and secure portal. They're one of the nation's leading telemedicine providers in acute care and behavioral health. But 5 quick points, right? These can hopefully remove some of those barriers. So if you are in need, you need to talk to somebody, strongly encourage you to do that. And again, you can do it this weekend, right? You can have that therapy session started there as well. So the cost, right? So I think as Kylie kind of kicked things off today, in terms of for Greater Tompkins and the consortium, wherever you might be, there's actually $0. It was listed on that flyer. So it's a great way that perhaps you can have a visit, and your cost share will be visible once you register your MDLive account. I'll actually show you at some point when we finish what my dashboard looks like. I actually have a $10 copay that I have to do, but it's great, right? There's no out-of-pocket costs that are there, but you do have to register your MDLive account. You can always contact Excellus Blue Cross Blue Shield, our customer care, at any point should you have any specific questions. That number can be located on the back of your Excellus BCBS subscriber ID card. If you have questions and if you want to talk to somebody specifically about MDLive, you can do that. You can actually, as Kylie mentioned, call MDLive directly, and they can help you and answer any questions regarding the platform, visits, scheduling, anything associated with the platform in your MDLive account. So just keep that in mind. So as the case, right? So healthcare can be complicated, health insurance as well. There are many conditions that we have specifically and helping to answer questions you might come up with MDLive. So MDLive, is it appropriate for every medical condition? So no, in this case, it is designed to help those non-emergency medical and behavioral health conditions. However, it is not intended to replace the relationship that you have with your primary care provider or taking place of talking to your primary. If you can't get in, it's a great resource. Again, if there are life-threatening emergencies, it is not an appropriate way to use MDLive. When should I use telemedicine with MDLive? So again, if your doctor is not available, maybe they have limited hours and it's a 4-hour wait on a Friday, you can't get in. Maybe you're out of town, you're going to the beach this weekend, you can't get into your doctor's office. MDLive may be an option for you. So just keep that in mind. When is MDLive available? So again, all 50 states you can access. So you're going to see a licensed board certified provider licensed to practice medicine in that state for acute illness, and then the same goes for behavioral health. It's a provider that's licensed to practice in the state that you are currently in. So just keep that in mind. Last question on here. So, and Kylie, and if you were listening at the beginning, she did actually answer this question. Is there a fee to register? So there's no cost to register your MDLive account. You're only actually charged if you do have a specific plan that has that type of copay on it. You guys do not in this case. But always check with your specific plan that you have. And once you register, you'll see any sort of cost upfront before starting any sort of MDLive behavioral health or acute visit. So you're only charged when you have that visit. So registration, right? So some great, prizes that all of you will have the chance to win. So I'm glad that the consortium has really built in an incentive here, because I think, having your MDLive account up and ready to go, maybe you never use it. I've actually had to kick off the new year 2 visits in January, actually one right around the holidays and the second one in the new year. I just could not get over this cough and sinus infection. It just seemed to last for like months, it appeared. But I was registered. I had my account ready to go. Those are the first 2 visits that I have had. So we're going to walk you through that in a couple different ways in terms of registration, right? So as with starting with any new provider, maybe you have gone to a new primary care provider, you've scheduled your annual visit, and you had to do a health profile, health questionnaire. Same thing goes with MDLive. So registration will include completing your health profile. Again, that's going to help the direction of care and help that provider understand, your family history. If you have dependents, the pharmacy of your choice. If you do take medications, what medications are you on? What are they helping? What maybe chronic conditions you might have? Again, that's going to help arm that provider during your visit. Again, if you have allergies to specific medications, knowing not to prescribe, an antibiotic, amoxicillin. My kids have those allergies, but understanding that those are going to be necessary in order to help get the treatment that you need there. As I talked about, dependents that are over the age of 18 will have to complete their own registration, as is the case with your spouse or domestic partner, and anybody related on the plan that's over the age of 18 have to complete their own registration. For those that are already registered, I'm glad that you have. I'm glad that you've taken that step. For those that have not, you will need your Excellus Blue Cross Blue Shield member ID card handy. So just a couple of plugs here. If you have the Excellus app on your phone, you lost your Excellus member ID card, you can pull it up on the Excellus app, or you can log in to order more. But you'll need that subscriber ID card. As you go through the registration process, we'll show you a couple of those specific slides. You, again, will need that full subscriber ID, including the 3-letter prefix. I'm not sure what the consortium's prefix is, but it's those 3 letters followed by the number sequence there. That is your full subscriber ID as you go through the registration process. So we've actually captured 4 ways to register here. You can start with your Excellus account. You can actually download the MDLive app on your smartphone and register that way. You'll have to input that information. You can actually utilize the text feature on your phone. Text the word Excellus to 635-483. Sophie, who is the chatbot for MDLive, will help you register. It will, ask those appropriate questions. Are you registering as a dependent, as the main subscriber? So you'll just follow those step process. And I have some screenshots of those coming up. Also, you can call, right? So as Kylie mentioned, if you want to talk to somebody and have them help you register your account, you can call 866-692 5045. So again, this is kind of the first step in completing and having your MDLive account ready to go. On the next slide, I'm going to, if I can go there. So this is going, the next couple slides are just going to break down what it looks like. This is the text registration option. So again, you have your mobile phone in front of you. If you text the word, you go into your chat feature, text the word 635483. It'll pop up. So Sophie is actually there in terms of helping you register your MDLive account. But I'm sorry, is there a question? Here's some talking. All right, I'll move on. In terms of what it looks like. So this is just showing you some of those questions that they'll ask. What is your gender? What's the member ID on the account? So again, it's going to show that subscriber ID, but remember you do need that 3-letter zip code or a 3-letter prefix. You will need to enter your zip code as well. But Sophie is the personal health assistant that'll help you register, but she also can help you set up your visits and ask those triage questions of what symptoms you might having. So you will see her once you get registered and are looking to have a telemedicine virtual visit. If you were to go through your Excellus Blue Cross Blue Shield account, this is just a couple of screenshots that will show you that process. So starting here in the upper left-hand corners, I'm looking at my screen, the username. So you're going to go to excellusbcbs.com/member. I'm going to I'm going to put in my username and password if I remember them. Maybe I forgot, I can reset it. But if you haven't created an Excellus account, again, this is a strong component to having your Excellus account. You'll have to create it. You can access it. So once you log in, there you're going to see find a doctor, and there's a telemedicine button. So it says set up a telemedicine visit. Click activate now. That's actually going to take you over. So there's a couple different ways. Again, if you're more familiar with your Excellus account, or maybe more familiar with having your smartphone, you do everything through your smartphone. This is just another option, and pretty much the same steps any way you choose to register your MDLive account. Sorry for all the buzzes here. So in terms of what you need, so first name, last name, current email, you'll create a username, create a password. You have to verify your email. Here you're going to see in the middle bottom slide screenshot, it's going to ask you if you are registering if you have benefits through an employer, an insurance provider, or a specific organization. I would click the word yes. So it's actually Excellus BCBS, and it'll pull down that. So you'll select that. So that's who your insurance is through as the third-party administrator, as Kylie mentioned, for the consortium. And then your medical insurance ID, which is your subscriber ID. Are you registering? Are you insured? I'm sorry. Are you insured as a dependent, right? So if this is your 19-year-old that goes to college and is going to register in the fall, they would click are you insured as a dependent? So that's where they would click yes. If you're the subscriber, you would click no. So just keep that in mind as that comes up. If you were to go right to the MDLive mobile app, this is what it would look like. Again, just download this in your app store, whether you have an Apple product or a Google type, the Google Play Store, wherever you choose, whatever type of product you have. Just download it. Again, once you do that, you're going to follow those prompts: first name, last name, email address. It is a benefit, so just follow those questions. Again, Excellus BCBS as your benefit provider there, including that 3-letter prefix and your full subscriber ID. So in terms of scheduling an appointment, again, having your MDLive account, now you've got your username and password. If you keep those in a secure place, you can actually have the visit on your laptop, or if you have a tablet, so you can have that access at any one of those types of devices. But actually scheduling your appointment will require you to log in. Here you're going to choose if that visit is going to be for yourself or for your dependent, right? So I have a 15-year-old in my house. She's not feeling well. I could actually set up a visit for her. I just have to add her to my MDLive account. again, you're going to select the type of visit that you have. And once you log in, you're going to see there's going to be, I call them buckets, if you will, but there's three kind of pillars or buckets. One is for medical, so that's your acute therapy. And then you'll see a therapy counseling. So maybe you do have some elevated mental health conditions, that you're experiencing, or maybe it's more elevated to where you need to reach out to a psychiatrist there. So you can select the type of visit that you're going to have for that individual or for yourself. Again, the symptoms that you're experiencing, right? So, pollen is driving me crazy. I can't get over it. It's just not letting me, have a great type of day. I can enter the specific symptoms that I have. If I have a fever, if I have, a cough, those types of things. So you're going to enter those specific symptoms. You'll be able to choose a provider. If it's, kind of immediate, if you need immediate help, usually within 10 minutes, you can see those that are available to have that telemedicine MDLive virtual visit, or you can schedule for some other time. Maybe tomorrow morning is going to work best for you, but you'll be able to schedule that type of appointment. In terms of scheduling for a therapist or psychiatrist, again, you do have to have an appointment on the books in order and choose the provider. You can, once you start those therapy sessions, you enjoy having those consults. We strongly encourage that reoccurring therapy session with that provider. So again, just wanted to call that out. After the visit, so any sort of summary, a SOAP note as they're called, if you want to share it with your primary care provider, you can. You will have to enter the primary care provider's fax number and have that information faxed over to your primary care. So again, having that visit, certainly is something that we want you to do. All right. So in summary, and then I'm going to jump over to the demo. I just want to show you what the dashboard looks like and actually how to start and set up your individual virtual visit. So 4 ways. So again, if you don't have it registered for now, here's something that you can do. It's pretty quick. It's a couple of minutes, but 4 ways. So you can download the MDLive app. You can start with your Excellus account. You can text the word Excellus to 635-483 on your smartphone, or call at any point. So I just wanted to cover those types of things. I will see if there's any questions at this point. As I do go over, I want to go into my MDLive account, but as I do that, I want to see if there's any questions, Kylie, that may have come up in the chat, or if anybody has anything at this time.
I haven't seen any questions in the chat, but feel free to enter them, or you can unmute and ask your questions. I did want to mention about registration because I have kiddos as well. Even if you just register as the subscriber, it makes it 10 times easier to add the dependents to your account when you need to, just by having that base account already established with MDLive. But I think Jason really summarized it really well. You don't wait to get an appointment, and it is a 0 copay service if you're on our platinum plan, which if you wound up going to urgent care instead, you pay $40. If you wound up going to the ER, because urgent cares aren't open at night, if you wound up going to the ER for a cough, that's a $150 copay. So there is some great savings here for your out-of-pocket expenses if you sign up for MDLive and use it instead.
Yeah, those are great points, Kylie. And I'm glad that you mentioned, I think that, the knowledge base in terms of where to go for care and get the correct type of care. Certainly if you have an acute illness, you don't want to go to the emergency room. It's, you're going to run into the chance of getting other illness. The cost is a factor there. So again, here is an option. Again, not meant to take place of your doctor, but certainly want to call that out. What I've got up here on the screen currently is what my MDLive account looks like. If I could join yours and not have that copay, but I do have a $10 copay. So as you register, again, it's a part of your benefits. You'll see that actually be listed for you. I'm sorry, I keep getting all these pop-ups. In terms of the medical visit, so I mentioned those 3 buckets: medical visit, therapy, psychiatry. You can see the wait times are up front. You'll see the cost up front. I can start any one of them. Again, either it's therapy or psychiatrist for behavioral health or a medical visit. Off to the side, I don't know why, but the links for the past like year are just broken, but I can still access them. You'll see my account, you'll see messages. So as you start to use the platform and you're engaging with providers on MDLive, you'll see that listed there. If you have upcoming appointments, you would see that specific information. I don't have any currently there, but just wanted to mention that. The care team also, sorry, my health profile, so is going to be there. I'm getting bombarded here. Hold on one sec. So with that, I'm just going to stop my shares because I want to turn this off. I know there's a lot of information here. Certainly get your MDLive account ready to go. Any additional questions from anybody at this time? All right, so there, I have muted that other piece and I'm going to go back. Bear with me one second. Let's see here. Close that part out and share. All right, so share my screen. I think I've gotten rid of that. So the health profile, right? So I need to enter my specific information, allergies, conditions that I have, specific procedures that you may have had over, medical history wise, biometric information, measurements, current blood pressure. Maybe you're on blood thinners, maybe you're on, any sort of those types of things. So creating your health profile is critical. Medication wise, again, listing any sort of current medications that you have. Again, this actually kind of goes back to my visit that I had. I was prescribed a medication. I was able to get that medication, pretty quickly to the pharmacy that's close by there. So I just wanted to call out that part as well. All right, so I did go back. Care team, if you have any sort of labs or imaging, any other uploaded documents there, but just wanted to mention that. So again, I can add my family members. I'm not going to click on that, but you can see what you would do as far as like your specific account, your insurance, your insurance information should be showing up there as well. But I'm going to go back here quickly to the main page, right? So it's 1:09 at this point. So let's say, 1:30, I want to see who's available. I can do that, or I can have a visit scheduled at any point. But I'm going to try and shoot for 1:30 to schedule it. I would add my dependent that in that space. It will help you identify your specific location. I'm in New York currently. Again, if you're traveling, if you're out of state, maybe you're in Florida or Texas, wherever you can't get into a doctor, you don't know where to go. You can have an MDLive. So Sophie, there she is again. She's going to help you. She's the chat bot. She'll ask specific questions. Allergies, I actually don't have any allergies, but it's very common right now. They're still all over the place. Maybe within the past 24 hours. So I'm kind of making this up. But again, you're going to do this to the specific type of conditions that you're experiencing. We'll say moderate. So she's going to go through. I'm not going to go past this point, but you can see answering these specific questions to help set up your own individual visit. That is the main dashboard. Again, within 10 minutes or schedule that appointment. You can see if you do have questions, there's additional resources that are found at the bottom. Anything that you might have in terms of reaching out or connecting with anybody, you'll see the number listed there, 866-692-5045. But definitely want you to have your MDLive account up and running, ready to go. And at this point, I just want to see if there's any other questions. If not, I definitely appreciate the time. Any questions out there? Comments, thoughts?
The only comment I was going to make is you can also get a doctor's note. So I know with some of our municipalities as the employer, they require a doctor's note if you're out of work for 2 days in a row because you're sick or 3 days. They can provide those as well. you know, for documenting that you've been ill and that you've met with a doctor. They can also do them for children, you know, if your dependents are on your plan and you have an appointment, and let's say the school says, okay, we really need to see a doctor's note, they can provide those as well for a visit. So very handy to have. It's all emailed right to you. I know in my case, I was able to email it right to the school nurse. So very convenient.
Yeah, great points. Thank you, Kylie. Again, just some other information if you want to understand a little bit more what type of provider. There's a quick video on here of how it actually works. So before you set up any visit, you can read a little bit more into it. Some quick educational points that are on each bucket. Again, learn more if you want to learn more about therapy, the type of provider that you should see, counselors, you know, just that um, talking session, if you will, but again, available for acute conditions and behavioral health and mental health at this time. So certainly appreciate the time. If there are any questions, you know, after today, you know, I'm here to help. If you want to bring them to Kylie, or if you want to call our customer care or MDLive, you can do that. But definitely appreciate the time today.
Thank you so much, Jason, for your time. I don't believe there's any more questions in the chat or anything else. But I'll leave it open one last time before we kind of close out our webinar for today. Oh, we do have a question in the chat. Let me go check that. I've never used it, but a coworker just did and said it was very helpful. I thought it was set with my cell phone app, but after today, looks like I have more to do to sign up. Yeah, just a few more steps.
Yep.
So Jason, you had mentioned about sharing the information with our primary doctor if we wanted to after a visit. Is there any way to set that up automatically so that MDLive would send it over?
Yeah, no, unfortunately, at this time, let me see if I can pull it up. It's like it's a manual thing. So if it is requesting, because you know there'll be thousands of those types of things where we need to send it out. So at this time, it's not an auto thing that goes directly to your doctor. It's at the need of that individual, that member at this time.
Okay.
Good question, though. I can't pull it up on my thing. I don't have one, that's why.
Are there any other
Yep.
questions? Can retirees with county insurance access services? Yes. So MDLive is available on all of our plans, including our Medicare supplement plans, our classic plans, our PPO plans that are ancient, as well as our metal level plans, our platinum, gold, bronze, and silver. It just depends on what plan you're on for your out-of-pocket expense. So some of those are copay, some you have to meet your deductible, and then it's a co-insurance. So, but like Jason was saying, you'll be quoted your out-of-pocket expense when you register and you're picking what appointment you want to make. Just waiting to see if there's any more questions in the chat.
Yeah.
I'm not seeing any more questions, but just a big thank you. So I really appreciate your time today, Jason, and everyone who joined us on this webinar. I hope you learned a little something about MDLive. I hope you go and register to be entered to win some of those prizes for our MDLive registration campaign that's happening. Oh, Diana, do you have a question? Or are you just clapping? I can't tell the difference in the hand emojis, so sorry. Clapping, thank you. Diana, thank you. So I appreciate everyone's time and I hope you have a great day.
Thank you so much, everybody. Enjoy. We'll see you.
Thanks, Jason.